Understanding the journey, signs and stages of labor. Every expectant mother ponders the onset of labor, curious about how it will feel, how long it will last, and how to distinguish between true labor and a false alarm. While each birth experience is unique and unpredictable, recognizing the signs of labor can help you prepare for the arrival of your baby. Understanding labor. Labor marks the commencement of childbirth, beginning with uterine contractions and cervical dilation, and culminating in the birth of the baby. As you approach your due date, you may observe subtle physical signs indicating that labor is imminent. These signs can appear anywhere from hours to days before active labor begins. Key signs of labor. 1. Strong, frequent contractions. True versus false labor. True labor contractions are consistent, becoming more frequent and intense over time. These contractions do not subside with movement or changes in position and typically last between 30 to 70 seconds each. Braxton Hicks contractions, on the other hand, are irregular and less painful. Self-assessment. To determine if your contractions signify true labor, consider their spacing, duration, and intensity. True labor contractions will not ease up and will make it difficult to walk or talk through them. 2. Bloody show. As labor approaches, you may lose your mucus plug, which seals the cervix during pregnancy. This can occur as one large piece or several smaller ones, and is often accompanied by a pinkish, thickened discharge known as the bloody show. This is a strong indication that labor is near. 3. Belly and lower back pain. Many women experience pain similar to menstrual cramps or a heavy pressure in the lower abdomen and back, which may radiate down the legs. Unlike false labor pains, these discomforts do not diminish with movement or changes in position. 4. Water breaking. Contrary to popular belief, a dramatic gush of amniotic fluid is not always the first sign of labor. For many women, the water breaks after other labor symptoms have already started. The fluid may trickle out slowly rather than all at once, and this event only occurs naturally in about 15% of births. Early signs. Labor is near. 1. Baby drops. Known as lightening, this occurs when the baby descends into the pelvis. For first-time mothers, this can happen a few weeks before labor starts, while for others it may not occur until labor begins. This shift can increase bladder pressure but also provides more breathing room as the baby moves away from the lungs. 2. Cervical dilation and effacement. As labor approaches, the cervix starts to dilate, open, and efface, thin out. This process can begin days or even weeks before labor. Regular checkups will help your provider track these changes. 3. Cramps and increased back pain. As your body prepares for birth, you might experience increased cramping and back pain, especially if this is not your first pregnancy. These sensations are due to the stretching and shifting of muscles and joints. 4. Loose-feeling joints. The hormone relaxin, which loosens ligaments throughout pregnancy, makes your joints feel more relaxed as labor nears. This helps open the pelvis for childbirth. 5. Diarrhea. Relaxation of the muscles, including those in the rectum, can lead to diarrhea as labor approaches. While unpleasant, it's a normal pre-labor symptom. 6. Weight gain stops. Many women stop gaining weight in the final weeks of pregnancy. Some may even lose a pound or two, which is normal and does not affect the baby's weight. 7. Fatigue and nesting instinct. Renewed fatigue often sets in as the body prepares for labor. Conversely, some women experience a burst of energy and an overwhelming urge to clean and organize, known as the nesting instinct. When to call the doctor. Knowing when to contact your healthcare provider is crucial. Call your doctor or midwife if you experience any of the following: bleeding or bright red discharge, water breaking, especially if the fluid is green or brown, symptoms of preeclampsia, such as blurred vision, severe headache, or sudden swelling, Labor is a unique journey for every woman, with each experience varying in progression and intensity. By understanding the signs and stages of labor, you can better prepare for the moment you meet your baby. If in doubt, always consult your healthcare provider to ensure both your safety and your baby's.